how are you doing today? My name's Danny. I'll be your student nurse. Can you please state your name and date of birth? Sandra Jones, 5/14/58. It's good to meet you today. How's your dinner going? I see you have your dinner. So it looks like you have to have insulin. Can we check your blood sugar? And you checked her blood sugar, and it looks like she does need her insulin. Do you normally give yourself your insulin, or you normally give it to yourself? Well, I can help you out with that today, okay? So you don't have to worry about that. Do you have any allergies or anything that you know about that you've noticed recently? No allergies, everything's good? Okay, so now that you're finishing up your dinner, I'll go ahead and go out and get your medications, and then I'll be right back. Just let me know if you need anything. There's your call light. So now I'm going to come out. I'm going to go to the bedroom, and I asked her name and date of birth. Her name is Sandra Jones. Her date of birth was correct. It looks like she needs 3 insulins. I looked up the insulins last night, and I know that we can mix the 2, so instead of getting 3 injections, she'll only get 2. We can mix the NPH and the regular insulin. So to do that, the first thing I'm going to do is clean off my insulins. Actually, first I'm going to verify that they're not expired. They're the right ones. They're mixed up properly. They're not expired, so we've got NPH insulin, 100 units. She needs 32 units subcutaneous. Alright, that's alright. It's not expired. It's not open. We're ready. The second one, it's the regular insulin, 100 units. Yep. 16 subcutaneous. And we're here for supper, so it's the right time as well. So now I'm going to go ahead and pop off the caps and clean them off for 30 seconds. Pretending that's 30 seconds. The package isn't open, it isn't expired, it's the correct needle, correct length, correct gauge. So I'm going to move this to make sure it's out of the way and to make sure that I can see my lines correctly. Now, it calls for 32 units for the NPH insulin, so I'm going to make sure to put the air in first. That way it doesn't have negative pressure and pull back in my other medicine. And take this off. It's 32. It's not touching. And then it says I need 16 units for the regular insulin. So I will go ahead and get that. Put that in, and I'll flip it over. This one I can get the air bubbles out of because it's not contaminated yet.
Yeah, that would have been better. I don't have the bubbles.
16, there's no air bubbles. And so I'm going to have my nurse come in and verify that this is correct. Oh, okay. Yep. 16. All right, would you mind go ahead and initial in right there? Okay. And it's the right 16. Okay. And then I'm going to go ahead, make sure that so 16 plus 32 is 48. There's no air bubbles. Gonna cap this off and go ahead and have the nurse verify that again. Grabbing at the bottom. There's 48 in there?
Yep, 48.
You want to go ahead and sign that off for me? Sure. Alright, thank you. We're going to go ahead and label this right away. It has the proper dosage of each, date and time, my initials.
So, first of all, I'm going to wear my mirror.
Then we're going to go ahead and set this down in a clean area. Next, we're going to get our pin. So for a pin, it has been used already. It already has a label on it. It's not expired. It's for the proper person. Right dose. So we're going to take this off. We're going to clean the top of this for 30 seconds. We're pretending that that's 30 seconds. So next we have to take this out. It's not open, it's not damaged, there's nothing wrong with it. Again, this is the same. It's I can get 4 units out of it. It's subcutaneous. There's the proper insulin, the right time. We're all correct on that. Twist this on. So I'm going to take this out. And then, so to prime it to make sure there's no air in there, I'm going to turn it to 2. See a bubble come out. My bubble came out. It's proper. I'm going to turn that to 4. I'm going to put this back on it. And I'm going to have my nurse verify again that it's at 4, so it's a proper dose. Do you mind verifying this for me?
Okay. It's the correct dose. At this time, I'm going to do my first check.
Thank you. You're welcome.
My first medication here says the
All right. This is ready.
I have this both insulin to mix. First of all, I don't even know if I can mix them.
And then
To my Skyscape.
next we'll go ahead.
Compatible to mix. Okay.
Check one more time that we have the right things.
Check it.
Right dose, right
Mix
insulin.
them, so which is fine. So I
Both
verify
correct,
that.
right time,
So,
right
the
route.
first medication here says
Same goes for the
so
pen,
this is
right dose, right time, right
usually
route,
called,
right
there's no
patient.
problem with it. That's how it's supposed to be. And I'm just
All
gonna
right,
roll it
so
around
we're gonna go
just
back
to
into
make
the
sure
room.
it mixes
We're
it.
just pretending
And,
that.
At this time, I'm gonna be
This is
checking
back
for
in.
expiration because I'm just gonna be checking to make sure that the
How was your dinner, Sandra? Was it good?
That's fine.
Good.
And I'm just gonna be checking
All right,
if
so you
there's
know how this
pH.
works. You're gonna have 2 little pokes on your stomach. Fortunately, we're able to turn your free insulins into 2. So after dinner's out of the way, she's all cleaned up. I'm gonna do this for you today. Is that all right? Okay. So one more time, can you please state your name and date of birth? Sandra Jones, 51458. Awesome. All right. So I'm gonna go ahead and get my gloves on. One more time. It's the proper insulin, proper person, right time. They had their food. The blood glucose is what it needs to be. Next, I'm just going to assess her stomach to make sure. So I would try to keep this as covered as possible, but we need to see for videos. I'm going to assess her skin to make sure that there's no hard lumps, there's enough subcutaneous tissue, which there is. There's no rash, she's not allergic to anything, so that's good. Alright, so the first one we're going to do is your NPH insulin and your regular insulin, alright? So I'm going to take this off. Lift up. So we're cleaning off her area. Alright, are we ready? Make sure I'm away from the patient. Alright. Clean that off. You did a great job, Sandra. There would be a sharps container here. Unfortunately, we don't have enough, so this is into a sharps container properly. Next, we're going to go ahead and do the insulin, the pen. All right, Sandra, you know how this works? It's just gonna push into your stomach and it'll click, and then that'll be the safety on it, and then we'll know it went in there, okay? Are you ready? Again, there's gonna be just a little poke, okay? Hold it in there for 6 seconds to make sure that the medicine came out. You did a great job, Sandra. So we're gonna go ahead and put this into our sharps container as well. I'm gonna mark off that I had done both of those right away, so just in case anything happens that we are ready for it, so the next person knows that it's done. Alright, Sandra, do you feel any burning or itching or anything that feels abnormal to you? No? Okay. Is there anything I can get you before we leave? No? You're doing good? Later on, I'll check the glucose levels to make sure that the insulin worked properly. And it did. She did great. She did a good job. If we were in a hospital, there would be a barcode that we could scan the MAR, the bracelet, and the medicine, but we're in a nursing home, so we don't have that today. You did a good job. I'm glad your dinner went down good. We'll turn the TV on to something you like, and then you have a great night. And then after that, make sure that until the doctor, any abnormalities, do hand hygiene, everything signed off, everything looked good.
My name is Abigail, and today I'm going to be